Our next speaker is Daniel Madrigal of the UC Berkeley Eskenazi Children's Center. His presentation is entitled Engaging Children and Adolescents in Environmental Health Research. Daniel?
Hi, everyone. My name is Daniel Madrigal, and I coordinate community outreach for the Center for Environmental Research and Children's Health at UC Berkeley. And I'd like to thank the organizer of the webinar for allowing me to share the work we do. Today I'll be talking about the youth engagement work that we do at the Chamacos study. And I'll start out with a little bit of background. Chamacos is a longitudinal birth cohort study of farm workers' children, and we investigate the association between pesticides and other exposures, environmental exposures, and children's health, growth, and development. Enrollment for this study started in 1999, and we've been following the Chamacos children and their mothers about every year and a half since then. And if you notice a photo in the upper right, that's one of our chamacas holding up a T-shirt that was given to her as a newborn. So we've been with this group for quite a while. The study takes place in the Salinas Valley, California, which is about 2 hours south of UC Berkeley, in an agricultural region that produces a lot of the fruits and vegetables that are consumed in the United States. And the work that I do with this study is the community outreach and translation. And our strategy is to develop activities and programs for all different segments of the community. We have presentations for parents and families. We have trainings for healthcare workers, clinicians, child care providers. And for pregnant women, we have a software program to teach environmental health concerns to be aware of during pregnancy. We have much more, but I'll be focusing on our youth engagement. Our youth engagement has 4 strategies. The first one is to make it fun. And if we're not engaging with the children we're working with, none of the messages that we're trying to teach will be absorbed. The second is to develop environmental health literacy. So to teach this idea that their surroundings, including chemicals in the air, the food, the water, can affect their health. They can make them sick, their families sick. And since the study takes place in an agricultural region, the main exposure that we focus on is pesticides. Our third objective is to teach prevention methods, so ways to reduce exposures. And then fourth, for older youth, provide tools to promote healthier environments. And the 3 groups of children and adolescents that we work with are our Youth Community Council, which are high school students in Salinas, our Chamacos study participants, in which we have our community forums, and then finally our puppet shows, which are for children ages 4 to 8. Our Youth Community Council is our environmental health leadership program with high school students in Salinas, as I mentioned. And with this group, our first project was a photo voice project for them to identify environmental health issues and concerns. And what we did was give them cameras and ask them to take pictures of things that impact health in their community. They discussed these photos amongst themselves and then shared them with their community and conducted an action project to improve the situations that they were seeing. I'm going to share one of these photos with you. And this photo, a youth member was bringing attention to the lack of safe space to get physical activity in her neighborhoods. Some of the other issues identified were poor access to nutritious foods, ease of access to tobacco and alcohol, lots of garbage in the streets. And some of the positive issues that they identified were a lot of open space in the area, and then plenty of committed individuals who are working to create healthier environments in their community. Once we had their pictures and summaries, they were shared with the community at the local public library, on a youth radio show, and then on public access television. The action project that our YCC members chose to do was put on a 5K run walk with another local health organization, and the idea here was to bring attention to the lack of safe space to get physical activity and then provide an opportunity for members of the community to come together and get some exercise. The project that followed our Photo Voice project was a community walkability survey, and the idea here was to explore the issue of safe spaces and what prevented people from walking as much as they'd like. And the youth in this project were involved in questionnaire design, administering the surveys, and then also data entry. And what this allowed them to do was learn about the research process, and this better prepared them to understand the environmental health research that's coming out of the Chamacos study. Coming up, we've been asked by the Monterey County Health Department, which is our local health jurisdiction, to provide trainings on health leadership for a nearby group of youth. So we're really excited that our work is being validated and supported and wants to be encouraged by our local community partners. We also have a cosmetic study where we will be assessing endocrine disruptors from personal care products in 100 adolescent girls. And what we'll be doing is measuring endocrine disruptors in urine. Then we'll be having those 100 adolescent girl participants use low chemical products for a week and then measure their endocrine disruptors in the urine once again after that week to see if the levels have gone down. And the youth will be deeply involved in this project as well, from questionnaire design to questionnaire administration and recruitment. And so these are some of the projects that the YCC has been involved with, and now be moving on to our Chamacos study participants. Since the beginning of the study, we've had these annual community forums, and this is an image from our community forum in December. And what we do here is we give presentations to the parents on our latest study findings. And in the past, for our children, we've given coloring books, but now that they're reaching the age of 12 and getting a little bit older and wiser, we realize that's just not going to cut it anymore. So we've started to develop activities and presentations specifically for them. This is an example of one of those activities. And the Chamacos study participants got into small groups led by a YCC member, and each group was given a newsletter with summaries of our recent publications. We then had a team-based competition where each team had to answer 5 questions related to the summaries and finish a word search that was on the back of the newsletter. And an example of one of those questions, in one study, we found flame retardants hurt children's brain growth. What are flame retardants and where can they be found? So this way we're involving these children in the research findings and making it fun at the same time. Finally, we have our puppet show, which follows the adventures of Lola, Lupe, and Beto as they learn about pesticides. And the puppet show is broken up into 3 scenes, each scene having a message. What are pesticides? Why are they dangerous? Where can they be found? And then finally, what can children and their parents do to avoid pesticides? And one example of one of those prevention messages is that parents who work in the field can take a shower before coming home so that they can reduce the pesticide residue and prevent that from coming into the house. And we've been really happy to hear that parents are coming up to us saying, so wait, you're the reason why my child tells me that he can't play with me before I take a shower anymore. And we're really excited to hear that those conversations are being had. And it fits within our greater community outreach strategy to reach out to many different segments and then foster conversations between the different groups. And this is our team. On the ground, we have Gardenia, myself, Kimberly, and Jose. And then we also have a lot of support and guidance from the Berkeley research staff, which include Brenda, Kim, Mary, and Asa. Our funding comes from the Children's Center grant and an EPA Region 9 capacity building grant. And our cosmetic study is funded by the California Breast Cancer Research Program. A big thanks goes out to all the children and families in Salinas, both who are involved with the cohort study and who are involved with our community outreach programs, for this would not be possible without them. For more information on our community outreach programs or our study, you can visit us at search.org. And I believe we will be saving questions for the end. Thank you.
Yes, we will. Thank you so much, Daniel, for an excellent presentation.